Hello, my name is Rennie Vaughn and I'm a registered respiratory therapist here at Shadoka Hamilton Health Sciences, and I'm introducing a video that's going to follow about volume augmentation using the breath stacking and assisted cough technique. The video will outline how to assess somebody if they need it, followed by how to do the procedure both using one individual to help and two individuals, and it will outline how often to do it as well. The video will also highlight some of the importances in doing the techniques, and the techniques are used in individuals that have weakened respiratory muscles, often because of a spinal cord injury or a neuromuscular disease that impairs the individual's ability to cough and clear secretions. So using breath stacking and assisted cough can help keep your lungs clear of infection. It can help keep the air sacs open in the lungs. It can help keep the chest wall flexible. It can help keep your lungs clear of mucus plugs. It can improve your own ability to cough. It can increase the amount of air the lungs can hold, which in turn can also improve the strength of your voice. So by doing this procedure 4 times a day, regularly, it can help avoid infections, but during a time of infection it's important to note that individuals might need to do this as often as every 10 minutes, much like we would during a cold. So it's important to use these techniques, and as a reference you can refer to this booklet, Keeping Your Lungs Healthy, to help refer back to the techniques that will be demonstrated in the video that follows.
Hi, I'm Rennie Vaughn. I'm a registered respiratory therapist, and I've got Dan with me here and Amy, a respiratory therapy student, that's going to help demonstrate the use of breath stacking using volume augmentation with an assisted cough. First of all, I'd just like to describe what a normal cough is. When we normally cough, we need to take a deep breath in first and fill up our lungs to full. And after we take that big breath in, we then need to bear down for a second to build some pressure in our chest so that when we cough we can produce a high speed. I'll just do one cough as an example. I take a big breath in and cough hard. And when we measure that, we call that a peak cough flow that I can do with a meter, and when it registers, it should register well over 300 liters per minute to tell us that the cough will likely be strong enough to get rid of secretions that fill up in the lungs if we don't remove them our natural way without a cough. Dan, because of some respiratory muscle weakness, isn't able to take a full breath in and doesn't have all the muscles to produce a strong cough. So I'm going to give an example of what his cough looks like just on his own, and then how we can augment that with the volume technique with the manual resuscitator and then with a thrust. So Dan, if you will, just take your best cough and cough into the meter. Okay, I'm going to look at it. It's about 140, 150 on the meter. Again, well below the, just keep it to the camera, just well below the 300 mark. Okay, just one more time. Best one, no cheating. Come on, big cough. Cough! Okay, and again, 150, yeah. Okay, so that's all he can produce on his own. So particularly in the light of an infection or something, if he had extra phlegm, it would be very challenging to move that phlegm out of the lungs, and that's often when they run into trouble with chest infections or pneumonia. So the first technique that individuals can use is just using an abdominal thrust, much like you use in CPR when you're trying to clear somebody's throat after they've are choking on something. And the important thing first is to find the appropriate position below the rib cage, or what we call the xiphoid process, which is where the rib cage meets. You always want to be well below that so that you're not pushing on that bony part. And then you find the belly button. It's your belly button. And the heel of your hand goes below that, keeping your fingers off the chest. And you can actually also use your thumb and your pinky to find the side of the rib cage so that you're not touching that area. And you time it with the person's breath, which is very important. So just before they're ready to cough, much like we would, you kind of mimic what the abdominal muscles would be doing during a cough, and that's by pushing inwards and upwards. You are trying to use the stomach contents with the diaphragm to help push the air out faster. And Amy will measure it this time just to see how much we improve it just with a thrust. Okay, Dan, big breath in, and cough. All right, what did we get? You can say it's 200? 200 on the meter. So slightly better. We'll do it one more time. Okay, big breath in, and cough. Okay, that was even better, eh? Yep. 300. So 2 to 300. So we can increase it, in other words, almost double it, okay, with just an abdominal thrust. So if you didn't have the equipment available, or if you're outside somewhere and you needed to help someone to cough, that is one technique that you can use with a person's own volume just to improve the strength of the cough. Now I'm going to show you what we use, which is a manual resuscitator with a couple of extra pieces of equipment attached to it to help fill up the lungs fuller than the person's able to breathe on their own. So a bag to a filter, and then it has this green piece is a one-way valve, which is an important part because once we push one breath in, the air would just come right back and empty into the bag. So this valve prevents it from coming back into the bag so that we can then stack one breath on top of another breath, and this is just called the flex tube so that it's easy to reach Dan's mouth, and a mouthpiece so that he's got something to put into his mouth. Before you actually start the procedure, it's important to test that your bag is leak-proof, and you can do that by occluding the hose and squeezing, and no air should come out. And this is a good example of a failed system, and if we made sure everything was tight and checked the system, I actually have a cracked valve, and we're using that as a good example because if I was trying to add the air to Dan, it would come out of the leak before I would fill him up. So that should be easily corrected with a new valve that works and is tight so that if I block it, nothing comes out of it. Actually, I'm going to, just a minute here, I'll use your mouthpiece. It's easier for me to check. There, I'll just squeeze it. And now I've got just about nothing coming out of the bag. There. Still got a little bit of a leak somewhere. Good example, eh? That's not tight. There. So I've got nothing coming out of the bag now. Everything was tight. So again, I made sure this connection was tight, and we have no cracked valves, and now we're ready to go. So what I'm going to do, I often do use, when I first assess individuals, just so that I make sure I have good measurements, I use nose plugs so that we don't leak when we're actually testing for values, but just for Dan's comfort. And just, I'm not going to use them actually for the video, so, but I just wanted to show them so that individuals doing it for the first time. And sometimes when they're first learning, I don't know if you remember when you first did it, if they'll, sometimes the air will want to leak out of the nose until people are used to directing the air the right way. So you might need nose plugs and you might not. It depends on the individual. Okay? All right, so here we go. What I'm going to do this time is I'm going to get Dan to take a big breath in through the bag all on his own until he can't take any more air in, and then I'm going to give him extra breaths. It depends on the person. Some people take 3, some people take 4, but that's assessed by the respiratory therapist when they first are started on the procedure, and then it also depends on the size of your hand. Some people that have smaller hands might need to have an extra breath or squeeze a little bit bigger, and usually Dan can tell you if he's getting the right amount of air. Okay, ready? Okay, so he's going to take a breath in on his own and breathe in, breathe in, breathe in. One more if you can, and cough. Great. Okay, so that came out to about 360. I'm going to show Emma. So just by giving him a deeper breath to what he would have been able to do had he had the muscle power to take his own breath in to the maximum he is actually able to, with just that, it improves his cough to be stronger. And I'm going to do it one more time. And just watch his chest this time as I'm filling him up after his first breath. And now 1, 2, 3, 4, and cough. So you can see that I can get it's about the same in terms of 330, just a little bit lower. It's, you can see that I can get 4 extra breaths on top of his own breath in. We call that his maximum inspiratory capacity. So if you're doing a breathing test, you'd usually take a big breath in and blow it all the way out. With Dan, we can get an extra 4 breaths. It's hard to say exactly how much, but with each squeeze it's about 400 to 500 milliliters, so we're probably getting at least 1 to 2 liters more air into him with just that. The other good thing that it does is it helps to keep the lower lungs clear and prevent them from collapsing down, because if we don't get air into our lungs deeply often enough, they're at risk of collapsing. Okay, and the last reason that we believe it helps, and that's why the procedure really should be done 4 times a day, is to help keep the chest mobile and it doesn't get stiff, so that over time you're not able to take a deep breath because your rib cage has stiffened up. So the recommendation for breath stacking is 4 times a day, and 2 of the times, if breath stacking alone doesn't create a strong enough cough, it should be done in combination with a thrust, which I'll demonstrate next. This is volume augmentation with a thrust, which should give us hopefully the best cough flows, because not only are you giving a bigger breath, but now you're also mimicking the abdominal muscles with a thrust to give you the most powerful cough possible. Okay? Okay. So it usually requires, you can do it with 1 or 2 people, but if you do 1 person, you position yourself on the floor, 1 hand bags, and 1 hand positions again below the xiphoid, above the belly button in an upward position, and then Amy will time the measurement, okay? Big breath in, and 1, 2, 3, 4, and cough. What do we got? About 380. We'll go 1 more time. All right, breathe in. And 1, 2, 3, 4, and cough. There we go. That's what I was looking for. 70. Okay. I just like to say this also can take practice with the individual if you're not used to the timing of things, because the thrust really should come in just before he opens up to cough. Because if the individual opens their mouth before you actually start the thrust, you'll lose the air because it's already started to exit, and you won't have time to build up that pressure. So it's really important that the timing comes into play. So sometimes give it a couple of trial runs before you actually start the procedure. And for good clearing, we usually recommend you do 3 or 4 times with each session, okay, in terms of you fill up and then you cough, and you repeat that 3 times. And often at the end, rather than ending with a cough, we just do a breath hold. We have to be careful when we're doing it in the chair with the breath hold, because sometimes if you hold your breath too long when you're full, you can cause your blood pressure to drop a bit and get dizzy. So we really avoid usually doing it in the chair. I'll get Dan to demonstrate it if he doesn't mind, just with a breath hold. So you take a big breath in, and you do the same big breath after 1, 2, 3, 4, and then just hold your breath. And that just helps recruit the air sacs that are lower down, that have need a little extra time of filling, and then he just gently lets it out. This way you're not ending with a cough and closing things up, and you just help keep things inflated. The one thing also I just want to point out is that there is a booklet, Keeping Your Lungs Healthy, that describes the procedure that I just went through. Also talks about how to clean the equipment that we don't need to get into in terms of the valve and stuff, but it is in here so that people have a reference to refer to, and also how often to do it. Do you have anything else you want to add, Dan, in terms of your experience with how to do it, or what you find the most challenging, especially when different people are doing it?
I think the most thing that I found challenging was the experience on the thrusting. Certain nurses and certain people who were doing the thrusting had different techniques every time. One of the main points, as Rennie was getting across, was getting acquainted with the person that you were thrusting with. And as the more times you do that, the more advanced you'll be able to get the cough and like that.
And do you find that the size of the squeezes are okay for most people as well in terms of?
Well, again, you said it's the size of the hand.
Yeah.
It depends. Every single squeeze is different.
Yeah. And do you find anybody squeezing gently versus like this? Is the difference?
I've noticed every difference.
Okay. And does that bother you when someone squeezes like that versus gently?
Yes.
Okay. Do you want to tell them what you feel is the difference?
It's almost like it's, instead of inhaling gently, it's an extensive inhale which my lungs will increase in size.
I just like to use that as an example because when we are showing people how to do it, somehow they think by squeezing the bag like this, they're getting more volume than squeezing like this. And there absolutely is no difference in volume, just the pressure that you're exerting to force that air in. And it's actually not only not a good thing, but you actually do exert more pressure squeezing the bag vigorously. So you really just want to use a nice gentle squeeze. Again, you have to think of when the person's breathing in. If I'm doing it with you, you're breathing in, breathing in, breathing in. So it's not like a natural way when you would just take a fill-up breath really quickly. So you don't want to do it too slow where Dan's sitting there waiting for 30 seconds to fill up. But the speed should come in one after the other, not in how fast you squeeze the bag. So I just wanted to point that one out too. And the thrusting, just to note, it is a firm thrust. Okay? If we think of the pressures we exert with our abdominal muscles, if we can measure it, they're quite significant. So usually people do start pretty softly. Do you find that?
They usually think that they're going to hurt the individual or they're going to cause pain.
Right.
But the softer they are, the less they're getting across with the thrust.
Right, right. And then the more often you're just going to have to do it. So with a couple of good thrusts, filling up first, you'll probably clear in a shorter amount of time, which in the end is less tiring for everybody. The one safety thing that I'll point out about the thrusting, it's good to keep a straight hand using your body weight versus your shoulder pushing so that you save your shoulder. So, and I think that's everything that we have to get across. Thank you.
Thank you.
Hi, we're here with Cody, and we're going to demonstrate the breath stacking with volume augmentation and assisted cough in the supine position or when someone's up in bed, because traditionally their morning and evening often is done in bed, and then during the daytime they can do the volume augmentation as seen earlier in their chair. What I'll do is, this is when you have two individuals doing it, breath stacking with the bag by one person, and I'll demonstrate the assisted cough using the abdominal thrust at the same time. But first, we'll get Amy and Cody just to volume augment. So you can, again, Cody takes a deep breath in all the way in on his own first, and then breathe in.
2, 3, 4.
And give me your best cough, Cody. So you can see it practically hit the camera over there. So without measuring it, it is quite a strong cough. But should he require even a stronger cough, that combined again with the abdominal thrust can get you your fastest flows. Just to demonstrate the proper position, I'm going to lift Cody's shirt up here, and finding the xiphoid process, you can just walk yourself up at the bottom of the rib cage. The belly button is right below that. You're going to aim in between that with your, again, with the heel of your hand, okay? And just take a big breath in, Cody, and cough. And that's the thrust without a volume augmentation, and then we'll do it with the volume augmentation.
Big breath in. And 1, and 2, and 3, and 4.
And cough. Okay, and one more time.
Big breath in. And 1, and 2, and 3, and 4.
Okay. Does that feel stronger, Cody?
Yes, it does.
Okay. And one more time. We'll just do a full treatment because we usually do about 3 breaths. Go again.
1, 2, 3, 4.
No, that's okay. All right. Don't just cough. Just let it out. If you miss it or something happens like that and you just don't have to proceed on, just stop, because if some air is out or if the person actually has to cough, it's good just to stop and then start again from scratch. The other thing that I'd like to mention is that sometimes when you do too many in a row, you can make the person dizzy because you are getting them to take really deep breaths a lot, and you can blow off your carbon dioxide too quickly, which will result in some people feeling lightheaded or dizzy. So give them a break in between just to let them breathe normally for a few breaths in between, and then that should have done it, right, Cody? You're not dizzy? And we'll go again.
1, 2, 3, 4.
There you go. So that's a good 3 coughs. And the other thing you can go up, you can continue to do it as long as someone needs to clear or still feels that they've got some phlegm or secretions in their chest. You just keep doing it until they clear, okay? And then at the end when you're finished, we'll just do a breath hold one more time. Cody, just big breath in. And 1, 2, 3, 4, and just hold for a count of 10. Just hold, count. That's 5, 6, 7, 8, 9, 10, and just let it out. So that's how we end. And just like I said earlier, that can be done with a longer breath hold in bed with a less likely chance of causing anybody from getting too dizzy. So just watch that one when if you're going to try it up in the chair. We usually recommend the breath holds be done when you're lying down because your blood pressure is usually a little bit higher when you're lying down. So the other thing is, like I said earlier, we have sheets on the wall recommending how the person does it, how many breaths they take. Cody, I'll just cover you up, okay? How many breaths they take after their own breath in, and then whether they use a thrust or not. Most people do it 4 times a day, twice of the times with a thrust, like I said. But their plans are usually posted above their head as well as the individual knows. But I just like to reinforce, during a time of a chest cold, you might need to do it as often as 10 minutes for certain periods of the day if you feel like you've got lots of phlegm in your chest. So it can be done a lot more frequently, but just for regular maintenance, we go for the 4 times a day. And the best cough will always be produced with the combined breath stacking with the bag and the thrust using the abdominal thrust procedure. All right? Anything you want to add about it, Cody?
Be careful not to pass out.
Yep. And in terms of, do you really feel it gives you a better cough than your cough on your own?
Yes, I do.
Yeah. Okay.